Hi guys, welcome to our YouTube channel Usmania Docs. Myself Dattatreya. Today I am going to interview Dr. Vaishnavi ma'am, anesthesia third year resident in Usmania Medical College. Over to you ma'am.
Hi guys, I'm actually impressed by the concept that you want to interview residents in Usmania.
Okay.
It's actually difficult to get a resident number and inquire about a branch. I personally couldn't talk to much residents in Usmania,
Okay.
so this is a good initiative.
Thank you ma'am. Our our viewers would like to know the anesthesia branch in Usmania General Hospital. Please share your experience ma'am.
So far, so good. So now, currently being third year resident, it's nice.
When did you decided your dream branch as anesthesia? While you are in a UG or after the NEET PG examination?
In UG, I didn't have any knowledge about anesthesia. In internship, I had experience during our postings. So basically, I am from Government Medical College, Nizamabad. There, anesthesia interns should work in anesthesia postings. So during those postings, we had got like knowledge about the branch and we had to work, right? So our residents used to include us in whatever they do, and they will explain. We used to discuss about various things they do. Like that, I got an inclination towards anesthesia during my internship days. Like at the end of internship, I was like, I will take pediatrics, anesthesia, psychiatry, or pathology. These were my options.
What factors motivated to you to take anesthesia in Usmania? Why not other colleges?
So Usmania is like top college in Telangana. First of all, 1800s it started. Then I've spoken to those seniors who are from Nizamabad. So basically, wherever we get posted in Telangana, we'll have peripheral postings. During that peripheral postings, we'll get introduced to this Usmania and allied hospitals.
Yes, ma'am.
So I talked to those people. They told like Usmania, you'll have wide range of exposure. So then and I started inquiring more into the branch.
Okay. How many PG seats are there in anesthesia branch in Usmania?
Currently 40,
40,
40 seats.
40, 40.
Yeah, 40.
Okay.
So anesthesia department in Usmania is like it's vast, it's big. It's so big that you have to travel a lot. There is so much traveling in Osmania anesthesia department.
Yes, ma'am. Various allied hospitals in Usmania, like Sarojini Devi Hospital, ENT Hospital,
Yeah.
like
So wherever there is a surgery, there is anesthesia. Wherever there is a diagnostics, like advanced diagnostics, there also you need anesthesia. Even for local cases, an anesthetist should always be present in the surrounding.
yes, ma'am.
That is the thing.
What is the course fee details and stipend details?
So currently course fees, it varies in all India quota and state quota. I've taken in all India, that time it was around 56,000, including the KNR university fees also.
Oh,
But only the college fees is around 29,000.
okay, 29K around.
Yeah.
Regarding stipend,
So currently, thankful to the Juda, we have got good amount of stipend.
yeah.
So first year 68,000, second year 70, third year 72,000.
Okay.
Mostly after 3 months, it will be regularly coming
Okay.
every month.
Does the stipend credited at a regular interval?
Yeah, it is like mostly at least before 20th of the month, you'll get the stipend.
Okay. And how was your academics in Usmania regarding anesthesia department? And
So-
how about seminars, thesis, and classes or conferences?
So, regarding academics, all PGs will have same roster usually.
Okay.
But first years will have introduction kind of roster for 1 to 3 months. They'll have separate classes where there are everything about basics, whatever drugs we use, instruments we use, everything basics. Separate focus is there for the newly joined residents. Then afterwards they'll be pulled into the regular schedule. It will be seminar based or class based. Mostly seminar based. Two PGs will be having a seminar moderated by assistant and associate professors, and sometimes professor and HOD also, based on the topics and everything. Roughly weekly we'll have 2 classes, usually in the afternoon, and at the end of the month we'll have exam pertaining to every year we'll have. Like first year in the same list of topics which have been discussed in the month, we'll have first year we'll have a basic topic questions as a question paper. Second and third years we'll be having in detailed
Okay.
and during the end of the course, before final exams, they'll start practical exam, practical case discussion sessions, interactive sessions, journal clubs. Everything will be there in the schedule. There is no need to worry regarding academics. If we follow that, it's good only. And we'll have OSCE sessions, everything. Everything they'll try to cover during the academics process.
Okay. Could you give overview of how anesthesia department will work in Osmania General Hospital?
Yeah, so actually in Usmania and Usmania allied hospitals we have to take. So Usmania is OGH, Usmania General Hospital, which is in Afzalganj Begum Bazar. So I would like to tell about some geography also so that you can look into it.
Yes, ma'am.
So Usmania General Hospital, Afzalganj is a busiest place in Hyderabad. One of the busiest place. You don't have metro here, only bus stop is there. I'll tell this also. I'll tell you why also.
Okay.
So then we have coming from Koti, Sultan Bazar Hospital, Sultan Bazar.
Sultan Bazar
Maternity Hospital, yeah. Then first maternity will have 3 maternities. Sultan
Yes.
Bazar Hospital, Modern Government
Maternity Hospital, Petla Burj.
Burj. Next Nilofer Hospital.
Yes.
Over 3 gynec hospitals. Next ENT Koti, Government ENT Koti Hospital. Next Oftal, Sarojini Devi Eye Hospital, Medipatnam. Next we'll have MNJ Institute of Oncology and Cancer Care.
Lakti Kapul.
Yeah, Lagdi Kapur, near the Nilofer Hospital. Next we'll have Chest Hospital, Government TB and Chest Hospital, Erragadda. Psychiatric hospital also is there. Institute of Mental Health, Psychiatry,
Erragadda.
IMH, Erragadda. That's it, no?
Yeah, that's it.
So these all hospitals, anesthesia people will be roaming.
Yeah.
So our roster is also taken care by our faculty. That is also no need to worry. Even night duties also, faculty only will arrange everything. Rest and all according to your things you can adjust with your colleagues. So we have 40 PGs, so that is also not an issue. So these 40 PGs will be divided as 20 first.
Okay.
20 PGs will be posted for 6 months in Usmania General Hospital,
Okay.
and 20 other PGs in all the other elite
Peripheral
hospitals.
elite
Peripheral elite hospitals. 6 months over.
Okay.
Then in that 6 months, you will have every month ka schedule.
Okay.
First month, then I'll tell OTs also, then you will know much. So I'll tell about the peripheral elite hospital. 20 PGs are there. Majorly 6 hospitals you will be get divided into. In that they'll like divide 3, 4, 3, 4. Every batch will have 3, 4, 3, 4 PGs in every hospital. You feel that is more, but that is very less.
Okay.
At every hospital there will be 3 to 4 OTs. Including emergency OTs, and in every OT you'll have 2 to 3 tables minimum.
Yes.
So then it all goes to like 1 PG will manage 1 OT. You will be given in first year also you'll be managing solo. You'll be flying solo only. Some cases, most of the time. Then Every month you will be divided. 1 month ENT, 1 month SBH, 1 month MGMH, 1 month Nilofer, 1 month MNJ.
Okay.
1 month divided 15 days into Ophthalm and Chest Hospital.
Yes, ma'am.
Then the thing is night duties. These 6 months you'll have in maternity only.
Okay.
That is for sure. Then other people who are in ENT, oncology, MNJ oncology, TB test, they will go. They will also go to maternity.
Okay.
They have to travel.
Okay.
So that's why I told the locations.
Yeah.
So morning, example, you are posted at MNJ Institute of Oncology. So morning you'll have there. Then you have to go to night duty 2:30 to MGMH.
Okay.
It is at Petler Bridge near High Court. You have to travel by yourself, however means you have. So that is the thing.
Okay.
From there, you'll do night duty. Next day morning, you have to come to your original elective OT.
Okay.
Morning 8 o'clock, 8:30, you will get relieved there. You have to come here.
Okay.
And some places don't have actually food also, canteen also.
Okay.
That is there. But most of the time it will be there. Anesthetists will eat nicely and sleep nicely. Sleeping is not there in night duties. Rest of the time you can.
Okay.
So that. And in OGH 6 months, we have so many OTs. OT1, OT2, general surgery, all surgical procedures will be done there. Laparoscopic in everything. Next, surgical gastroenterology, one of the best OTs in the Telangana and Andhra Pradesh,
Okay.
in government setup.
Okay.
So it's a modular OT where even liver transplants also happen, and you will be part of liver transplant from your first year.
Okay.
There you'll learn in depth about long duration surgeries, transplant surgeries, and pediatrics also. Pediatric transplants also happen here, so that post-operative care regarding that also. So that is the thing. Then we'll have a orthopedic OT, OT4. That is also good. Many TKR, THR, replacement surgery, everything will be done there. Then OT3 or urology OT. There also we have elective renal transplant, cadaveric renal transplants, and everything. So some like when we have a brain donor, usually an anesthetist who is involved in the brain transplant team will be get notified. Then he will follow up the case. We'll take the case into RICU. So we have RICU also, ICU setup where anesthesia is the head. So there RICU we will take, we will maintain the normal homeostasis. Then organ retrieval will be done in the surgical gastro OT.
Okay.
Liver people will take liver, kidney people will take kidney, ophthalm people will take cornea, skin people will take skin, and everything. So that is the thing. It's happening very nicely. Good exposure.
Wide range of clinical exposure from
very
all
good.
hospitals.
Yeah. Then afterwards we have neurosurgery OT, cardiothoracic OT.
Wow.
Then I told you about RICU. RICU has a prolonged ICU need, respiratory care needed, ventilated patients. Less patients, more exposure, more focused care will be there.
Yes.
Then we'll have a plastic surgery OT.
Okay.
It has wide range of exposure. We'll go to medical gastroenterology for ERCP procedures. ERCP and colonoscopy, which will need sedation.
Yes.
We'll be going for MRI, CT scan for sedations.
Yes.
Then we'll go for psychiatry hospital for sedations. Next, emergency OT will be there. These all places will be posted 1 month, 15 days, 20 days, whatever, however split. This is all. I think I've come. This is the whole places we roam. And wherever you roam, you have to attend the class at 3 o'clock till 5 o'clock.
And what is the work of first years, second years, and third years?
So first years, usually they'll be at OT by 8 o'clock.
Okay.
They have to arrange their tables, their respective tables. Their colleague have to help their friends, colleagues, whatever. Then they have to check the pre-anesthetic checkup,
Okay.
which is already done in the previous day. But at the morning also we have to ask. First question we ask, when have you eaten last? when is your last meal and everything. Then whatever advice we have written, is that done or not. We'll check vitals.
Okay.
And we will take, usually we'll be shifting the cases by 8:50, 9, before 9:30 we'll shift inside OT. And early on only within 1 month, so like 1 month into our residency, sometimes even 1 to 2 weeks also, we'll be starting getting involved into the work. First day only they'll tell to keep cannula also, so no one will tell to watch and observe and all.
Yes.
You have to work in Usmania. We have to work. We have to involve. We get involved from day one. So whenever whatever circumstances you have, within 1 month you will be giving spinals
Yes.
under the guidance of your seniors, senior residents and faculty.
Yes.
Then intubation also, if you are lucky, you'll be doing intubation within 1 to 2 months of your residency.
Yes.
And like by 3 to 6 months, you will be daily. You'll do any procedure, spinal or intubation.
Final intubation.
Any procedure daily you will do. Daily 1 or 2 times, 3 times also you will do. So like you'll get comfortable with the procedure, and it should be like muscle memory,
Yes.
so that in that also you'll like smoothening your technique. Usually those all we have to maintain the hemodynamics and everything. So like first year resident, in first month and in your 6th month it will be different. Whatever procedure you'll do, you'll become smoother, faster,
Yes.
and with minimal assistance or zero assistance. Then you'll get involved into the difficult intubations part, like in OBs, pediatric intubations and everything, and difficult airway and everything. How to use different gadgets for difficult airways, that you will do. Then slowly you'll start giving epidurals under the guidance from 6th to 9th month to 12th month.
Okay.
Usually epidurals you'll get, most of the OTs you'll get. In some OTs you'll not get at all. In ENT there is no point of giving epidural.
Oh, yes.
So that it goes that way. In MNJ almost every case you should intubate. In every case there will be an epidural. Then you'll start assisting for central lines with your seniors. Everything assistance. Then you'll do solo.
Okay.
How many times you will assist also, you'll become faster. Then in emergency situations you'll be like you'll be confident in giving,
Yes.
because there is lots of caseload. In OGH emergency OT, roughly we will do 3 to 8, sometimes 11 cases also per night.
Yes. That's a great
In
workload.
12 hours like that. Roughly you'll do pakka 1 to 3 intubations. If there are many intubation calls that day from casualty, from all the wards you'll be getting calls. Medicine ICUs, everywhere you'll be getting intubation calls. Any ward you have to go. Difficult cannulas you have to go. Central line calls. And ventilator settings assistance, sedation calls will be there, that you have to do. So solo you will go by 6 months. You'll go solo and do intubations. First seniors will come, then you'll do solo. Even spinals, first seniors will be there, then you like, here the concept is sometimes senior will give you some leeway so that you will get confidence to manage a case by yourself. That is the point, because we have to train you in that way. We have to train ourselves in that way, because there is no one. Sometimes you have to do alone.
Yes, ma'am.
Then in Usmania, the perks. In Usmania, we have so good OTs. We have so good equipment, so beautiful, and care stations, automatic equipment, video laryngoscopes, everything. In some OTs, you have basic boils where there is no ventilator and you have to bag yourself.
Okay.
The bagging thing is like how many times patient should breathe, you have to bag those many times. If you forget breathing, patient will not
Die.
breathe, he will die. That is the thing. And
yeah.
monitoring equipment also, some places you have a best of the best monitoring equipment. Some places you have only pulse oximeter and NIBP, blood pressure. So there also should know how to manage.
Mm.
I feel a resident who does a PG in anesthesia, they can go anywhere. They can start an anesthesia department also, right from boils, oxygen cylinders, changing cylinders, everything you will know. Some places you have to do everything.
So we get to know everything regarding.
Uh, and being in government, you will know what by work, technician work, assistant professor work also.
You will be working even in adverse conditions, so you will get well
Adverse
versed with.
exterior conditions. Everything you will know.
You will
And
know.
you will know how to work when there are absence of some drugs.
Yes.
Some medicines will not be there. Someone like there will be restricted supply. Not only in Usmania, even in any government college, you will have some restricted supply. You have to make work with that only. That you will know. That is the benefit of usually joining in government colleges.
Yes.
And like in anesthesia, you need to be versatile regarding equipment and all jugaad things. People who like to do that machine works, like repair things, set things to make them work. Those all things you like. That will be interesting only.
Okay. How are your duty hours usually, and how often you get night duties per week, and do you get a post duty off?
So like night duties, I'll tell per month we'll have usually 6,
Okay.
sometimes 5.
Okay.
Sometimes 4 also if you're lucky.
Okay.
So it depends.
Uh,
But not more than 6. Usually sometimes 7 very bad situation. In that also you'll have 1 or 2 holiday duties where you have to work 24 hours, morning 8 o'clock onwards. Okay, this is the thing. And all public holidays you'll have.
mm,
All government public holidays. This Onam, Sankranti, Diwali, everything.
yes, ma'am. And how are your night duties usually be? Will you get a shift?
So basically, night duty means some in maternity hospitals it will be different. Here OGS it will be different. In maternity hospitals it will be like first year, second year, third year, or 2 first years, 1 second year, 2 first years, 1 third year, like that. Two first years, 2 third years also sometimes. In Nilofer they will keep more PGs because we have pediatric OT also and obstetrics and gynecology also. Emergency cases mostly will be of OBG only, but sometimes pediatric cases also will happen. Actually, when pediatric case will come, it will be at different floor altogether, and obstetric emergency will be a different floor. So, will based on that they will divide. And so third year you'll be relaxed only. The relaxation of third year depends upon the training of his second year or first years basically. uh, but every case will be informed to the third year and assistant professor usually. Even whenever you go to one night duty in gynecology, you'll have ICU rounds. First all maternal ICU rounds you'll have. Then you'll know which case is bad, which case needs more focus. That case will be rotating and visiting frequently. If it is normal, everything normal, then only whatever the emergency case will come based on that. Sometimes they'll call for difficult cannulations and everything. And any cases of shortness of breath, dizziness, status epilepticus, pre-eclampsia, eclampsia cases, that cases they'll call off wherever they like triage areas and everywhere they will call like that. So cases based on the load, some days it will be comfortable, you will sleep, some days you can't.
Based on the cases.
Based on the cases. The cases are stable and simple. Like first year only will give off based on their confidence and everything. Second and third years will be till the starting of the case, then they will relax when they have trust on their juniors and everything. Usually in Usmania, because there is lots of caseload, it will be like you'll get used to it. You'll get used to what the surgeon will ask, how to do what, how to manage, and all. You have to observe basically. Monitoring is important. Then in OGH, night duties will be posted like 3 to 2. RSU is separate and EOT is separate. Two buildings are there. So RSU people will take care of one building calls and RSU. There when one senior, one junior. Over. Then in EOT, it will be like one more building. There you have 2 to 3 seniors. Then every batch will have 2 to 3 members. So if the caseload is normalish, like only one table is running, the others will take turns and sleep. They'll attend just calls.
Do PGs get a post duty off?
No, there is no pure post duty of in Usmania.
Okay. How is
But based on your colleagues, you can manage off. Like one day you will work more, one day you will work less. Post duty off based on notice, you can like during the lunchtime you can sometimes. Most of the OTs will get completed around 3 also. That's fine only, I guess.
how is the work-life balance in the Department of Anesthesia?
So it's good only. Usually, whatever you have work, you will do off and go. In first year, you will have pre-anesthetic checkup works. In Usmania, there is no such thing as pre-anesthetic clinic.
Yes,
The thing is, who is posted in what OT, they will do their OT PSs. Suppose I am posted as first year resident in orthopedics OT. I will get off OT list. 6 cases, 8 cases are there. We will divide ourselves. First years will divide ourselves. You do 2-3 PSs, I will do 2 PSs. Like that, they will divide. Everyone will do PSs. They will inform what all specific things are there to be informed to their senior, then to the faculty. Complete, go over. Then if next day OT will come, those cases you will review, you will take over the case, you will do the case. If everything goes normal. If anything happens inside the OT during the anesthesia, BP is high, low, any complication, then you have to take an extra care and you have to follow senior.
How is the senior-junior bonding and is there any toxicity?
Toxicity is like you have to work basically. If you don't work, anyone will scold you. That is there. There is no such excuse as not working. But if you are sick, if you are having time to do things, if you are slow, you'll be given pretty good amount of time. But you have to improve your pace. Anyone will give some time only, right? Usually, I've told you, right? This 6 months postings
yes,
and
ma'am.
this all. You'll be posted with seniors. Same set of seniors, you will travel 6 months.
Okay.
Night duties also mix and match. Similar people you will be encountering. So you'll know their styles also. Seniors, there will be usually, if the work is done properly, case is going smoothly, there is no normal issues or any need to run and everything. Then usually the juniors can ask any doubts they like. Seniors will also like who are in third year, they will be preparing. They will also keep on discussing. Or sometimes seniors will tell like small topics, half an hour, 1 hour readable topics. To have some active discussion, they will give some topics so that there should be active learning and all. That way it goes. Whatever doubts are there, usually approachable only and discussable. Even with faculty, Usmania faculty are like very friendly, I feel. Assistant professors, associate professor. You should not have any inhibition to ask them. Whatever you ask, it will be discussed pretty good. Even faculty also will give some questions related to the OT and everything. For suppose currently I'm in neurology OT, neurosurgery OT. Then neurosurgery relating that you have to have some pretty basics. So that basics will be started discussing day 3, day 4, day 5. Then we'll go deep into the subject. Whatever we want, we can ask.
Okay.
If we ask only, we will know how to
Yes,
manage
ma'am.
alone. So senior junior discussion part is good. There is no such thing as ragging much.
Okay.
Just small comedy things that.
Mm.
Yeah. Even seniors will teach language also sometimes.
Okay.
Yeah. They'll help with this for non-locals pertaining to non-locals. They are facing any difficulty in conversing with the patient. Seniors will help. They'll not like you have to learn why I should help. That is not there.
Okay.
They will understand and they will teach.
Okay.
That is there. But anesthesia you have to talk. For small duration, you have to make big impact.
Yes, ma'am.
So you have to talk in such a way that patient can trust in you, trust you in 5 minutes, and remember you in 5-10 minutes. That is there. You have to make big impact for small duration,
Yes.
where the patient is awake. For spinal anesthesia, there goes lots of counseling in gynec.
Yes. What are the pros and cons of taking Usmania?
Pros, mainly Hyderabad.
Okay.
Easy transportation. We have to think in every way,
Okay.
not pertaining to residency. First, I will tell other aspects. I told so much about anesthesia, right? So, first of all, Hyderabad, easy commuting. Usmania is like in the center core. So, all bus stops, railway stations are almost nearby. There is no problem. Traveling to hometown, even airports are also very nearby, like 45 minutes. That's it. That is there. Wide range of food. You can work if you know only Hindi also. Hindi is bare minimum. Sometimes Hindi is more than Telugu.
Yes, ma'am. Hyderabad.
Hyderabadi, Urdu, Nizami people. So Hindi you know means Telugu people can understand Hindi. That is there.
Yes.
But you have to learn Telugu also. And then food. Food is good. Everywhere you have good food, good people, comfortable in roaming and everything. Then Usmania Anaesthesia Residency. Wide range of exposure. I told you so many OTs, you have to roam so many OTs.
Yes, ma'am.
So it will be like you'll get used to working in different OTs. You like whenever you go out after your residency, you should be working in many different places, right? You'll not be working in one place. Wherever you go, you'll be like, acha, in this OT where you have to look out for everything, whatever you need, and then you will start a case. That way it goes. And in Usmania, we'll have people from all over the state. People coming in different comorbid conditions, in very bad shape, very bad state. In EOT, we'll have patients, everyone who is almost septic. Everyone will have severe inflammatory response syndrome, shock. These all complications you'll know how to manage. Even in Nilofer, usually Nilofer, why I am specifying because, so in Nilofer, why I want to specify, Nilofer is a tertiary referral center for all the hospitals in Hyderabad. Government, private also. If patient is having any comorbidities and there is a need, you have to resuscitate a baby or any need for baby, preterm labors, baby with any anomalies, abnormalities, immediately you have to have a pediatric center. People will come to Nilofer. So you'll see pretty comorbid conditions in Nilofer. And other Sultan Bazaar MGMH is like a factory of deliveries. So many cases will come. It will be like every day you will have one pre-eclampsia case, 2 days, 2 duties once you will have an eclampsia case, pakka, placenta previa, creta, everything will have. So many cases will come. All malnourished. Anemia is very common. In MGMH, every patient will have anemia. So you will learn how to manage everything.
Okay.
How much you should do, how much you should not do. That you will learn everything. Then here also you'll have all patients coming in septic state and everything. In Usmania, I told you you have to work with bare minimum also. You'll not have any infusion syringe pumps in some places.
Yes.
You should go like counting the droplets ml per hour. That way also you should do. So you can work everywhere. And basically anesthetists are like they should be versatile, like what I feel. And even IC is also okay, pretty good only. You'll have ultrasound, e-fast also. RAC is having almost all equipment, I feel, but still needed. But whatever it is there, it is very good only. There will have an ultrasound. You can learn 2D echo, e-fast. Some OTs we have ultrasound. There also we can learn all everything almost we'll learn, and we'll be managing patients with comorbidities. That is the thing. Even in ERCP is normal procedure only. Whatever we'll learn in surgery, ERCP is done, stunting done, that we will learn. But when we will go for ERCP, you will understand how ERCP is. You will be alone, and patient will be very bad also. Cholangitis, pancreatitis in bad state they will be. They'll have all elevated LFTs, they will be malnourished, they'll be ascitic. You have to manage everything on your own. So, these all things you will learn.
Okay.
So, basically, whenever you will learn to do wherever you can, like anywhere you can do things means, then you'll start focusing on what to read, how to read, that also. Then if you will see so many patients with comorbid conditions, then you'll start learning more. Actually, anesthesia is dry subject. But if you will see the patients, you have patients here, you will see the patients, you will learn. You will practice, and again you will learn. You can discuss also. If you see a bad patient only, you will have a point of discussion.
Yes,
Like
ma'am.
if you see a patient in epilepsy or status epilepticus only, you'll feel like discussing. Simply, you'll discuss what is there only. What is in front of you, you will discuss. So here you will have wide exposure. So you will be like exposed to so much.
Okay.
Even in anesthesia, transplant, everywhere.
Okay. Ma'am, what is the scope of super specialization?
Like anesthesia is actually a wide branch. When I took anesthesia, I didn't know this much, but after getting into it, I understood that it is widespread and different, versatile. So much is there to learn and everything. Nowadays, general anesthesia, like normal anesthetist, also we can practice. But people are going so much into specialties also. So we have so many super specialty options. Like in general medicine, general surgery only, we have so many options. So these branches goes like critical care medicine option is there. Then we have transplant anesthesia, obstetric anesthesia, pediatric anesthesia, neuro anesthesia, regional anesthesia, cardiac anesthesia, cardiac CTVS, this will be there. In these super specialty branches, you will have more focused critical care pertaining to that branch also. You even if you do a cardiac anesthesia, you can go and give a spinal for gynec case. That is there. So however you want, you can work. You want to work neuro anesthesia, you work for 10 to 20 years. Then you can go do normal cases when you are older, when you want more time for yourself. And the practice also, how much you want, you can do. You want 9 to 5, 9 to 8, 9 to 4, 9 to 5 means you can do like that. You want shift based, you can do that. Then you want to do high freelancing, you can do anything, you can do. You can work based on institution, you can fly solo also. Whatever you like, you can do. So anesthesia is very widespread and interesting branch only. I wish more people come into it, and the people who don't come into also, please know about it so that you can educate yourself and others also. So I thank these Usmania docs for doing such a great job, bringing into so many departments and everything. Even I also watched so many videos. I couldn't get many videos on even anesthesia, there was no such video on Usmania. So I help this helps you. So like, share, subscribe about the channel.